COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
COVID-19 or coronavirus is here, so it's important to have the correct information at hand, like knowing the symptoms, a high temperature, a cough, shortness of breath or breathing difficulties. If you have symptoms, self-isolate to protect others and phone your GP. Visit hse.ie for updated factual information and advice, or give us a call. Protection from coronavirus. It's in our hands.
How to safely wear a face covering. Wash your hands well with soap and water before putting it on. Without touching the front, put it on so that it covers your nose and mouth. It should go right over your nose and the bottom of your chin. Hook or tie the covering straps so that it fits closely and well to your face. Avoid touching your eyes, nose and mouth at all times. Take the covering off from behind. Store it in a plastic bag until it can be washed. Once it is off, wash your hands well with soap and water. This is very important. Wash your covering regularly with normal detergent in a normal wash. Don't forget, a face covering may help prevent people who do not know they have the virus from spreading it to others. It is not a replacement for washing your hands or keeping the 2-meter distance.
Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam, then rub right palm over the back of left hand with interlaced fingers, and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe. Please note that this technique is not appropriate when hands are visibly dirty or after using the toilet. In these cases, hand washing is required. Hand rubbing should take you 20 to 30 seconds. Use a timer or count 1, 2, 3, 4, 5 in each of the following steps. Apply a palmful of alcohol-based hand rub in a cupped hand, enough to cover all surfaces of the hands. Rub hands palm to palm, then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of your fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Once dry, your hands are now clean and safe.
Everyone can join Ireland's fight against coronavirus by downloading the HSE's COVID Tracker app. It helps reduce the spread of the virus in Ireland while protecting your privacy and keeping a secure anonymous record of people you're in close contact with. It can alert you if you've been in close contact with someone who tests positive and helps us with contact tracing if you become ill. So the more people who use the app, the more people we can protect. Download the HSE's COVID Tracker app at covidtracker.ie. Stay safe. Protect each other.
COVID Tracker, helping you to stay safe and protect each other. How to install the app. Go to the App Store or Play Store and search for COVID Tracker Ireland. You will see the icon from the official HSE COVID Tracker app. Click Get or Install to download the app. How to set up the app on your phone. In order to use the app, you must be 16 or over and accept the terms and conditions. Follow the on-screen instructions to get set up. The app needs certain permissions in order to work. You will be asked to accept these. You can change the permissions and privacy settings through your settings at any time. Contact Tracing Active. In the Contact Tracing tab, you will see a tick mark to show the contact tracing is active. If contact tracing is not active, you can access your device settings to fix any issues. How the app works. The app uses Bluetooth to make a secure, anonymous record when people using the app are in close contact with each other. The app does not collect your name, location, or movements. Your data is collected anonymously and stored only on your mobile phone. COVID Check-in. You can help us understand more about COVID-19 by recording any symptoms you have. This will help the HSE see how coronavirus is affecting people across Ireland. If you have symptoms, the app gives you advice on what to do. It also gives you a record of when you started to feel unwell if you are talking to a doctor or the contact tracing team. Close Contact Alert. If you've been in close contact with someone who tests positive for COVID-19, you will receive a Close Contact Alert. Follow the advice on the app to protect yourself and others. Contact Tracing Call. If you provide your phone number, the HSE's contact tracing team can phone you if you are a close contact of someone who tests positive. Uploading your close contact records. If you test positive for COVID-19, you can choose to upload your records to anonymously alert your close contacts. The app does this while protecting your privacy. You will receive a secure code by text message from the HSE so that you can do this. Updates on COVID-19. The app also gives users easy access to the latest facts and figures about COVID-19 in Ireland. Every additional contact that the app can trace will improve the HSE's existing contact tracing operations and help to stop the spread of the virus. The more people that use the app, the more effective it will be. Stay safe. Protect each other. Download the COVID Tracker app from covidtracker.ie.
All members of the school community will be required to wear face coverings at all times, as a physical distance of 2 metres cannot be maintained. This is to comply with DES and HSE guidelines. As well as the use of face coverings, hand hygiene, including regular hand washing and hand sanitising, is essential to keeping our school community safe. Every classroom and public area of the school now contains hand sanitising stations. All visitors, including parents, may only visit the school after making an appointment. A one-way system to regulate movement will be in operation for all students and staff. Here is a brief look at our one-way system and the preparations underway to ensure the safe reopening of our school. Finally, when school reopens, we must remember to wear face coverings, practice good hand hygiene, practice social distancing, avoid crowds, and know the symptoms of COVID-19.